Thank you, Mrs. Bedlington, Nicola, for the kind introduction. My name is Sam Gidding. I'm a semi-retired pediatric cardiologist and now a trustee of FH Europe and co-chair of the World Heart Federation International Working Group on Familial Hypercholesterolemia. I'm here to talk about the global call to action, which originated and was convened by the World Heart Federation and the FH Foundation in the United States to bring more awareness to familial hypercholesterolemia worldwide. What is familial hypercholesterolemia? It's an inherited genetic condition that causes very high cholesterol and early heart attacks. If you have heterozygous familial hypercholesterolemia, you have one gene that raises your cholesterol dramatically, typically well above 5 millimoles per liter or 190 milligrams per deciliter. You have at least a 50% chance of having a heart attack by age 60 if you're not treated. You can be treated effectively with drug treatment, and as many as 1 in 250 people, one of every 250 people in the world has this gene. More rare is homozygous familial hypercholesterolemia, about 1 in 300,000. Here you have 2 of these high cholesterol genes. Your cholesterol is extremely high, typically well over 10 millimoles or 400 milligrams per deciliter. And heart disease can begin in childhood, and you do not generally have a good response to drug treatment. Familial hypercholesterolemia runs in families. For a heterozygote, who is shown by the half red identification in this picture, we have a grandparent who has FH, a child of this grandparent who has FH, and it's passed on to further generations. For a homozygote, there are 2 grandparents who each have the gene or heterozygotes, and they have one child who's a homozygote, and that homozygous child obligatorily passes FH on to all their children. Familial hypercholesterolemia was first brought to the world's attention in 1998 by a WHO consultation, and this was to raise awareness about this condition. Roger Williams was the leader of this group, and there were many colleagues from around the world who brought attention to FH. However, despite the fact that the cause of FH led to a Nobel Prize, 20 years later, not enough had changed. Though treatment had improved and genetic diagnosis was more available, it remains the most common life-threatening genetic condition. It's found around the world in all races and ethnicity, and most startlingly, 9 out of 10 people born with FH remain undiagnosed and are at high risk for heart disease. Now, FH Foundation World Heart Federation convened 2 international meetings. These are all the countries and organizations represented to develop consensus reactions published in JAMA Cardiology 2 years ago. This led to the global call to action on FH. In the map, you see all the countries involved, including most of the European countries. 34 million people worldwide have FH. Recommendations related to raising awareness, the most crucial issue related to FH, because even over 60% of physicians aren't aware of FH. To have advocacy for this condition, not just for political awareness, but to provide support for the many patients worldwide who are suffering with this condition. To screen, test, and diagnose for the condition, to treat FH, to guarantee care for the most severe form, because this is a very rare and debilitating condition. Most important, because it's genetic, to develop family-based care plans, to continue research, and most importantly, implementation science research, because we have the treatments. We just have to get them to the right people, to fund FH registries so we can monitor FH care, and to understand the value and cost of this treatment. Most of the medications are generic and are low cost. FH is underdiagnosed worldwide. This map, based on the Familial Hypercholesterolemia Studies Collaborative Information, our international registry, shows how underdiagnosed FH is worldwide. The pioneering program in the world, which you'll hear more about later, is the Netherlands. A second pioneering program is in Norway. In these countries, 30 to 50 to 70% of the people in the country have been diagnosed. However, in the rest of Europe, that figure is considered to be less than 1%. Overall, worldwide, less than 10% of people are diagnosed. And for children, less than 5% are diagnosed, because most children are diagnosed only if their parents are diagnosed. So not only does a parent have to be diagnosed, but that parent has to bring their child to medical attention to get the diagnosis. Most of these people also are not getting sufficient cholesterol lowering medication. FH care is complex. These are the elements of an FH care model. It includes diagnosis, assessment, screening of relatives, performing the genetic testing, the clinical management and care. In severe cases, using new treatments and what's called apheresis. This care has to be organized, and there has to be an organized approach to screening for FH to identify the many undiagnosed cases. These 9 recommendations resonate highly with patients. This is unpublished data from research that I personally am working on in the United States, which shows the importance of the screening, diagnosis, and treatment recommendation and family-based care to patients. We've interviewed over 75 patients who have FH, and their spontaneous comments, almost 100%, emphasize the importance of family-based care, because people with FH look to their relatives for support, and they also look at the experience in their families. And they point to the urgent need for early diagnosis. Over half the people with FH are diagnosed after they've had their heart attack. And we know that if you begin treatment in childhood at age 10, you may never have to have a heart attack in your entire life. This is a modeling exercise as to the importance of lowering cholesterol early in life. On the far right, in the green line, is the general population. And that shows that the average person reaches the horizon where a heart attack could happen by about age 55 years. The more traditional risk factors you are, the earlier you reach that horizon, and the more protective factors you have, the later it is. On the far left is the bar for homozygous FH, the most severe form of the condition. In this setting, children reach this horizon for having a heart attack by 12 and a half years. If you're a heterozygous FH, you reach it at 35 years. Now, the light blue line shows that if you start treatment with a very high dose statins, a potent medication, you can attenuate that to 48 years. But if you start a low dose medication, you can actually return the person to the general normal population risk for a heart attack at age 55 years. And this has been shown, and data on this will be presented later in the meeting. High dose statin, begun at earlier in life, or intensification of treatment early in life, may actually keep a person with FH heart disease free. How about the cost of such a program? Again, the Netherlands is the model for our knowledge about this condition and its impact on people's lives. This shows the cost, the ICER, for FH compared to other conditions where screening programs currently exist. These include cervical cancer, breast cancer, and colon cancer. The cost of FH care is a fraction of the cost of these other high-risk conditions, which are already screened for. And the frequency of the FH gene is much higher than the risk for many of these other conditions. In conclusion, what is the role of government in helping advocate and manage FH care? Well, we know from research around the world that all successful FH care models which have originated have relied upon government to be successful because of the complexity of the FH care model. We also know that a country-specific approach is necessary. The best practices to deliver guideline-based care are not known, but we do know that different models work better in each country. Government support is required for research and registry funding. Care must be scaled for resources available in high, middle, and low-income countries. And most important, for those most severely affected, government policy must guarantee care for these patients. Thank you very much.